Thank you so much, Katie. I've known Katie for over a year now, before she tore her ACL, and when I heard that news, it was just devastating. It's great to have her here, but it's too bad that she's here under these circumstances. So thank you for sharing your story, Katie. I am Dr. KARLI RICHARDS. I am a podiatric surgeon from the United States. I practice at Richards Orthopedic Center with UPMC Medical Center. My grandfather was an orthopedic surgeon. My father is also an orthopedic surgeon, and I am lucky enough to practice medicine with my father. The reason I got into this study of ACL injury is because of my sister. When she was a high school soccer player, she tore her ACL twice and also suffered a traumatic brain bleed all on the soccer field. And she's 11 years younger than me. When I was starting my medical practice, she was a high school soccer player, and I witnessed all of this during my first year of practice. And at that time, in 2008, I was asking myself, why is this happening to our women players? Because at the same time, 2 to 3 players on her team also tore their ACL. So that is why I'm here. That is my passion, and to educate. I'm sorry, I don't know why these slides keep clicking through. Don't move. To educate all of you on the things that I've learned in the last 15 years as to why this is happening to our female athletes. So we'll start with this graph that you can see on the TVs. These are injury rates, female versus male. The women are represented in green, the men in orange. You can see women are 5 to 8 times more likely to tear their ACL than a men football player, 2 times more likely to suffer a concussion, and 5 times more likely to suffer an ankle sprain on the pitch. These are some players that all of you know that tore their ACL in 2022. So 57 players of the top 6 leagues in the world tore their ACL in 2022. That was just in 2022. I haven't looked at 2023 yet. I'm a little bit nervous to do that. But you know, these are some really big names out there who have made this topic more prevalent in our daily conversation when we talk about women's football. So I want to ask everyone a question in this room. Who in here personally knows someone who has torn their ACL playing women's sport? Raise your hand. Okay, that's quite a lot of people. Who in here knows someone who has torn their ACL in the last year playing women's sport? Okay, so that show of hands in itself tells us we need to do something. We need to provide more education for our players, for our coaches, for our stakeholders, so that we can decrease this injury risk. So the first thing I'm going to talk about is a little bit of anatomy. There's a few doctors here, but we are all not doctors in the room. So I brought this knee model all the way from Pennsylvania in my suitcase, and it made it. So I'm going to show you what the ACL is. This up here, this bone, this is our thigh bone, our femur. This down here is our tibia. This is your patella, which is your kneecap. Inside this spring-loaded ligament, this is your ACL. It attaches your thigh bone to your shin bone and stabilizes the knee joint. You can see as the knee goes back and forth, it's a stabilizing force. When that tears, we lose the stability of our knee. And so that it's nice to have a visual, and you guys can pass this around and look at it then, as to what we're talking about. Because we talk about ACL and we're never quite sure without seeing it what that is. Okay, so that's what the ACL is. So these are some contributing factors of increased injury in the female athlete, and this is cited in the Journal of Orthopedics. And I personally believe that all of these things contribute to increased women risk for ACL injury. One is anatomy. Our anatomy is different. Second is neuromuscular. We are stronger in different places than men. Hormones do play a role in the ACL injury. Shoes and playing surfaces also play a big role in these injuries and directional changes on the field. That's a picture of my sister. She's got a knee brace on and headgear, and that was after all 3 of her injuries. Believe it or not, she kept playing in college, and she did okay. So that's a picture of her on the field, and those are all the things she had to wear to continue her play. So we want to prevent all those braces from being worn on the field. We want our athletes to be healthy during their play. So here's some examples of the female versus male anatomy. The female hips and lower extremity have the pink triangle, and the male has the blue triangle. So the first thing I want to talk about is what we call the Q angle, and that's an angle from the hip to the knee. And the normal Q angle is anywhere from 12 to 20 degrees. Men tend to have a much lower Q angle, towards 12 degrees. Women are higher, more towards the 20-degree range. The higher the Q angle, the more we have what's called internal tibial rotation, so the tibia turns in a little bit more, and we also have a little bit more pronation of the lower extremity. So pretty much women turn in a little bit more than men. That puts more pressure on that ACL ligament in general, regardless of whether you're playing football or not, that anatomic difference. The femoral notch is also something that you can read about in medical literature. That is the area on the femur where the ACL attaches. So if you bend the knee all the way back here, it is this area right here that this ligament attaches to. In women, it's smaller than men, so it's a little bit more narrow. So when there is an injury, there's a little bit more force on that ACL because the notch is smaller. So it's higher torque, right? So if you have that plant and turn injury and that ligament is pulling on the femur, that smaller notch can sometimes increase the risk of tear. A third thing is lower extremity alignment. Like I talked about before, the hips, the wider hips can cause a different alignment of the lower extremity and cause increased pressure on the inside of the knee and inside of the shin. So lower extremity alignment in female athletes greatly contributes to their injury risk. And also the foot type, and this is for men and women. People who pronate more, people with a flatter foot, have increased risk for knee injury because the pressure is going more on the inside. Someone with a higher arch, the pressure goes more on the outside of the leg. So that's something that's also of interest for both men and women. So this slide is on our muscles and the neuromuscular difference between men and women. So our hamstrings and our quadriceps support our knee. In men, the hamstrings and quadriceps are about the same strength, and usually a little bit stronger than women, depending on the training. I've had some women say, we're just as strong. Yes, we are just as strong. But in general, from an anatomical standpoint, usually the men's muscles are a little bit stronger. Sorry, stop advancing. Can you stop the slides from doing that? We also, as women, are what I call quadricep dominant. That means our quads are usually stronger than our hamstrings. The quads are in the front, hamstrings are in the back, okay? What that does is causes us to land with our knees straight. So when we come down from a jump, or a header, or whatever, and you land, usually with a woman, the quads fire more than the hamstrings, and that causes the knee to extend. So the knee does this, okay? That puts more pressure on the ACL ligament. So those are all differences, anatomical differences, that I think are important for us to know as players, as coaches, as physiotherapists, that can be addressed to help prevent some of these injuries. Now we can go to the next slide. Okay, hormones. This is one of my favorite topics because nobody really talks about it. And we need to. We need to talk about this from 6th grade on. It's an important topic for girls and women to feel comfortable with, especially in the sporting environment. We should talk about this with our coaches, with our parents, with our trainers, with our physiotherapists, because it affects how we perform on and off the field, okay? And this is one of the big differences between men and women, and we need to recognize that and embrace it. We shouldn't be scared of it. We should talk about it, because there are some subtle changes we can make to help us with our hormonal cycle as women. So some studies that have been done show that Women can be more likely to tear their ACL ligament during the late follicular phase of the menstrual cycle. That's what we call late phase 2. It's after you have your period and right around the time of ovulation. That's when estrogen levels are high and progesterone levels are low. And it can also cause what we call ligamentous laxity, where the ligaments surrounding the knee are a little bit looser, so you don't have as much stability. Okay, it advanced for me, that's fine. So this is a nice graph that shows different phases of the menstrual cycle. And I like this because sometimes even as a woman, I'm like, I don't know what phase I'm in, you know. But this is good to look at. I learned visually. So the red bubble, that's phase 1. That's during your period. It's from the first to the last day of your period. The purple bubble, that's what we call phase 2. It's from the end of your period to ovulation. And then phase 3 and 4 are after that line in the middle. Phase 3 is when the hormones start to go up, and then phase 4, they start to go down, and then you go into your cycle. So that's how this works. Where that arrow is, that is the more common time to sustain an injury, okay? And I think this is good to understand. You know, I'm not saying, you know, women shouldn't play during phase 2 or we should, you know, stop the menstrual cycle. No. This is just for educational purposes, just to have a better understanding of where we are at as female athletes and what we can do to help support those different hormones during our cycle. One of them is with training, and a second is nutrition. So there are different times during the cycle where your training can be altered, and also your nutrition can be altered. So, for example, in phase 1 and 2, your energy levels are higher because estrogen is higher. So that's a good time to actually do high-intensity training and weight training. During phase 2, when you have a little bit more ligamentous laxity, you need to have recovery days so that your muscles can recover. So if you play a really hard match during late phase 2, you want to make sure you have 2 days of recovery, okay? During phase 3, that's a little bit before a period when we become hungrier and our moods change a little bit, okay? We can change our diet during this time. You should eat multiple meals a day during phase 3 instead of 3 big meals. And, you know, protein is important throughout. So there are modifications that can be made during different phases. And actually, Dawn Scott, I'm sure some of you have heard her name. She was a nutritionist for the U.S. women's soccer team during their previous World Cup, not this past one. She period tracked every one of those players on the team and made a nutrition plan that was individual to every player based on their cycle. So that's how important it is. And yes, they do this at the very high levels. Heck no, we're not doing it anywhere else, right? I'm lucky if I'm a mom to 2 daughters. I have a 17-year-old and a 10-year-old daughter. The 17-year-old, we do this, and she's like, oh, come on. I'm like, no, this is important, and here's why. And, you know, it really helps her to understand her cycle and why different things are happening to her during different times of the month. But she's a high-level athlete, and it helps her with training. So I think this is important for all of our athletes, regardless of injury potential. I think this needs to be done starting at a younger age. So another factor is the playing surfaces that we're on and the shoes that we're in, okay? As many of you know, there's more propensity to injury in a turf field than on a grass field. And even worse if we're switching fields. So if you have a player that's practicing on grass and then playing on turf, the injury rate's gonna go up. Same if you're practicing on turf and then playing on grass, because it's a different game. You know, on turf it moves faster, the body changes positions more quickly than it does on grass. Another thing that's interesting is the cleat tends to get stuck in more on turf. And that's what we call that plant and turn injury. So that's when the foot gets stuck and the leg continues to go and that ligament tears. So if you're on turf and you have the wrong stud length on your cleat, it can get stuck in that turf, and that will increase your risk of injury. Okay, and that's for men or women. But what we're looking at in the women's game is the equality. You know, we don't have equal access to the same pitches as men. We're moved around more. We get what's available, right? So that has to change. We need more consistency in the women's game to help equal the playing field, right? We need equal playing fields to help, you know, decrease this injury rate. So that's a big deal. The other thing that's important is stud length. People don't know this, especially in the youth level. If you are playing on a turf field, you need a short, more conical stud. If you're on a grass field, it can be longer. Most kids have one pair of shoes, and I'm sure that's on higher levels too. And they will use those same shoes on any surface, and that will increase injury rate. So that's a really important piece of education that nobody knows, and that's easy to teach people. I was asking Katie earlier, I said, does your coach, you know, tell you this is our surface, make sure you check your cleats? And she said, no. I mean, that's easy for a coach to do. Hey guys, we usually practice on grass, but today we're playing on turf. Everyone check your studs. Make sure you're not blades, right? Because that will really increase your risk for injury. So that's something that's simple that I think we can all change going forward, especially on the youth level, because there's no education on, you know, you go to a shoe store, you buy a pair of soccer cleats, no, parents don't know to look at the stud length. Nobody knows that. So, but that's very important, especially in America. You know, there's so many turf fields now that our kids are playing on, and, you know, many of the shoes are not made for that. So that's important education for all of our players. The other thing I want to talk about is the female anatomy of the foot. So we know we're different. Well, guess what? Our feet are different too. So women, two things. One, we have a little bit wider hips, so we turn in more. We pronate a little bit more. We also have a wider toe box, okay? There are not many soccer cleats on the market made specifically for women. That is starting to change. I have two examples up here that I'll show to you, but it's not common. They're hard to come by. And a lot of times you'll go to the store and they'll have, you know, I've done it, you go to Dick's Sporting Goods, there's a sporting section, you go to the women's cleats. Most of those cleats aren't women's cleats, they're men's cleats that have pink on them, or purple. But it's the same shoe, right? So we need to have shoes made specifically for our women athletes because we are made differently. And two companies that have done it, one is IDA. I've actually worked with them. They're a fantastic company. They make soccer cleats specifically for women. And this is one of them. It has a wider toe box because we have, our metatarsals are spread out a little bit more than men, so it accommodates for that. They have a different cleat pattern on the bottom, and the studs are a little bit more conical. So they're shorter, more conical. That allows the foot to slide a little bit with the leg to help decrease the risk of injury. They've also added an arch support, which is a big deal because it decreases the pronation of the foot. So if you think about it, pronation means you turn in. So if you put an arch support under that, it turns you out just a little bit and takes that pressure off the medial knee. So those are some things they incorporated in their boot. Nike just came out with one, and I got my hands on it. So it's called the Phantom Luna. This is cool. It has a circular pattern for the cleat underneath. I don't know if you guys can see that. So if you think about it, when the foot plants, the idea is the foot will slide in that circular motion with the leg. And that also reduces that risk of the plant and turn ACL injury. And this is when I say plant and turn, I mean non-contact. You're not getting hit. This is one of the most common ways that athletes get injured with the ACL, and that's what happened with I'm sorry, I keep calling Katie out, but that's what happened to her. She had a non-contact ACL injury on a crappy turf field. Yeah. And you know, her foot didn't move with her leg, and that was it. And so we need to, in the women's game, promote these things, get them out there and encourage more companies to make similar products to keep our players safer, okay? An interesting thing about this plant and turn ACL injury, my grandfather was the first orthopedic surgeon to describe a non-contact ACL injury in 1972, which is pretty cool. He used to work with American football players, and that means not soccer, football, and would have these athletes come into his office, and they're like, "Doc, my knee really hurts. I didn't do anything. I didn't get hit. I just turned, and I think I sprained my knee." So they used to treat these as knee sprains because there's no contact. No one got hit. There was no impact. And so they would put him in a splint. They'd wrap him up, sit him out for 2 weeks, get him back on the field. Still couldn't play. Knee was unstable. Couldn't figure out what was going on. So after this happened a few times, he took these guys into the operating room to figure it out because there was no MRI, there was no CT scan, there's no, all they had was X-ray, which only shows bone. So he took these players into the operating room, cut them open, and was like, "Oh, look at that, the ACL ligaments torn, as well as, the medial lateral collateral ligaments, meniscus, whatever." But he saw this enough and was actually taking these players without a direct impact to the operating room. He talked them into it and wrote a paper on it. And so that's where this comes from. And now here we are in 2023. We're still talking about it, but now we're saying, okay, we were always talking about men, right? This is what happened to the guys. We have to start focusing on women and our differences, because that really plays an impact to that first slide I showed you as to why our injury rate's so much higher. It's all these reasons. It's not just one thing. And there are studies that are done on female athletes, but they're specific. Like there's a study on neuromuscular. There's a study on anatomy. There's a study on plane surfaces. There's study out on hormones and the menstrual cycle. But we need it all together. We need to really look at this as a whole. Like we need to look at our athletes as a whole and figure out why this is happening so often and what we can do about it. So as I just spoke of, these are the causes of ACL tear in the field: a sudden stop or decrease in speed. You're running to one end of the field, all of a sudden the game changes direction, you plant your foot and you go, and the foot doesn't turn with the leg. Poor landing after a jump. This is what I talked about with that quadricep dominant issue. When a female athlete comes down after a header or lands, oftentimes the knee extends, and that can cause that ACL injury, and that's from a neuromuscular issue or the thigh not being strong enough in the correct areas. And this is, landing technique is a big deal. We need to focus on that with our athletes as well, but it needs to start when they're little. You can't teach, a 17-year-old how to land after they've been doing it wrong their whole life. So these are things we have to focus on when youth football, youth soccer, we should be taking our girls and teaching them the correct way to land so that we don't have to teach them when they're older, and it's much harder. So this is, a lot of this has to start at the youth level. Obviously, a direct collision can cause an injury, and then sharp directional change. If you're dribbling down the field, you want to change the direction of play, you move with the ball, and again, your foot doesn't move, but your leg does. So those are all things that can cause the ACL injury on the field. So prevention is key, and that's what this is about. I'm here to give you education on what I think the causes of these injuries are and why it's more prevalent in women. And I'm going to give you tools to use to help educate other players, coaches, owners on prevention. None of this is 100%, obviously. We're still going to have ACL injuries, but I think it'll help. So strength and conditioning for female athletes. It has to be female specific. We can't take a trainer right out of school and put them with a women's soccer team and say, train the athletes when they don't have that training going, throughout their education. When I was a Division I athlete in college, my strength and conditioning coach was the head strength and conditioning coach for the Notre Dame men's football team, not soccer, football. And these guys were massive. And I was a diver. I was on the swimming and diving team, and he was my strength and conditioning coach. And, he modified whatever they did with these big football players, but it wasn't correct. It wasn't specific. And we need to be female specific. It has to start with education, and it has to, we can't substitute a strength and conditioning coach from a men's team and just throw them with a women's team. They have to know what they're doing. We need female-specific nutrition programs, like I talked about with the menstrual cycle. That's very important. And it helps with training, it helps with recovery, it helps with hormonal flux. Football boots need to be made for female anatomy. There are 2 on the market that I know of. I know that some more are probably coming, but it needs to be faster, and it needs to be a broader array of boots. We shouldn't just have to choose from 2. And I have no affiliation to any of these companies. These are just the 2 that are out there. And I'm a podiatrist. I like to look at shoes, so I wanted to get my hands on these. And I think they're well made, and the idea is right. We need education on the menstrual cycle with nutrition guidelines, and we need consistent training surfaces. If you're going to play on turf, you should be practicing on turf. If you're going to play on grass, you should be practicing on grass. We need to make sure the cleats are correct for the playing surfaces. So those are all points that if you take, those 5, we have the information to help with all those 5 things. We just have to start to implement them with our players and our clubs. So these are some good references if you want to check them out. The FIFA 11 Plus program is a good strength and conditioning program for both men and women. The Fitter Woman app is cool. It actually helps you track your period and gives you nutrition guidelines on how you should be eating and training during different parts of your menstrual cycle, as well as Orico. So I think those 2 are partnered, the Fitter Woman and Orico, but the Orico website is similar in giving that type of information. The shoes that I showed you, the Nike Phantom Luna and Ida cleats, are made specifically for women, so definitely check them out. And as I said earlier, we need consistent training services and appropriate shoes for those services. So to end this, what I'm going to say is I have all this information I just threw at you. I have my ideas of why this is happening. I have my recommendations on what we can do to change some things, but we don't have enough data. I can give you a study on everything I talked about today, but I can't give you multiple studies on everything I talked about. So we need more female-specific research. We need, a bigger data bank to look at all of these factors and say, okay, let's look at neuromuscular, let's look at shoes, and study hundreds of athletes and see which one might be the causative factor. How do hormones really play a role? We need more studies in all of these areas, and we don't have them yet. So as a physician, it's hard for me to give definitive recommendations. I can say, this is what I know is going on, this is what I think you should do, but we still don't have enough data, we still don't have enough research to support it all. So we need to invest in our women's game. That's what we're here to do. We need to talk about these things. We need to invest in our players. We need to invest, in their health, right? We need to put money into the medical research and then supplying them the appropriate doctors, trainers, nutritionists, so that they can be healthy throughout their careers. And if something does happen, then we have to support them on the other end of it. We have to get them the best surgeon. We have to get them the best recovery team and get them back to the pitch as soon as they can. But that all requires investment, and it's a team. Like, I can't do this alone. We need to all get together and make this happen for our women. So, thank you.